welcome back to our show. I'm joined in our booth by my buddy, Lori Bristol. She impresses me greatly, a diabetes educator for many years.
Just a couple so far.
Just a couple. Mm-hmm. But what makes her more of an expert, in my book, she's had diabetes.
30 years now.
For 30 years. 30 years is on insulin.
Yep.
And then I was just learning that you've been running races lately.
Well, I've ran races now, I guess since early 1990 or so. But I've upped the intensity, and I run about 60 races a year so far. Do 5Ks, 10Ks, up to half marathons.
Wait, 60, that's more than one a week.
Yes, there are some days that I run in the morning on Saturday, and in the evening Saturday afternoon, and then sometimes there's a Sunday afternoon race too.
Who hosts these races? I've never...
Different people. Sometimes it's for a fundraiser for different organizations. Sometimes it's just for fun. We'll be running this Saturday here at AADE for the Novolog race that they'll be having.
And so you're on an insulin pump?
Yes.
And the pump goes on the race with you?
It does. I always wear that. I sometimes suspend, but not typically. I find that my blood sugar tends to go up during races and down during training runs because of the stress and the excitement of a race.
Okay, we got to look at this. You have let's say they're 2-mile races. If you're training, blood sugar will go down. Mm-hmm. And if you run a 2-mile race, it goes up.
It does.
That just explains why people get so confused.
Yes.
Because if it has stress, your body is like releasing all of this sugar.
That's right. When I'm in a training run, that's relaxing. That's a stress relief for me. And so my blood sugar will typically fall when I'm running for a training run.
Even if it's the same speed?
Yeah. And then on the Saturday mornings of races, I will typically find that I may start at 150, but by the end of the race, I'll be up at 220. Even though I've ran that distance and not suspended, it still will go up. Again, I think because of the cortisol levels and all that.
And that's just the stress releases cortisol and
adrenaline and all those hormones.
So how is someone, a viewer, to know? I just trial and error.
It is, and up to the point that I got to wear the sensor, it was trial and error. I would check my blood sugar right before a race, I would check it right after a race, but I didn't carry a meter during the race because I don't want to have to carry that. But that's how I just learned over time, and I would correct it, but with a sensor, I could take care of it right then.
Tell us more about using this sensor. You didn't find it, you found it worthwhile, obviously.
Oh, extremely worthwhile. My insurance does not cover it, but I plan to purchase it for myself when I get ready. The data that I was able to glean from that, I made changes in my basal rate because every morning I was going up, and I figured out it was from the stress of going to work. And so I noticed that made a change in my basal rate. I noticed that I wasn't bolusing fast. I tended to bolus right before I sat down to eat, and I found that if I really will bolus 15 minutes before I eat like I'm supposed to.
That's the Humalog and Novolog?
Yes. That will
minutes.
I could see that it didn't trend up quite as high. I was able to keep it more level if I would wait that 15 minutes like I was supposed to.
You're getting me excited. I haven't worn this, but I think that would really be a great... Sometimes when you have diabetes as long as we have, you kind of have to start over. And I feel like I've published 10,000 articles about diabetes. It's so hard to go to the doctor and say, my blood sugars are too high, because I know everything, right? I mean, nobody can tell me anything. No, I'm just kidding. No, but just having a new tool, though, would be great, because you go to a doctor, they tell you cut back when you're going to run, and obviously, they don't know. They're not in your body.
Right. And the thing about the sensor, they have one sensor that you wear with the Medtronic meter, but you can also get their continuous glucose sensor that you can wear with another type of pump or no pump at all, just so that you can get readings. So it's out there for the general diabetic public.
That's what I want. So you're recommending the continuous meter. Mm-hmm. And tell us about your practice and how you got involved in diabetes, became a diabetes educator.
Well, I've been a nurse for 21 years so far, and I've done a lot of different jobs, but the diabetes program in my county, the lady was retiring, and she knew me because I was a school nurse. And so she asked me if I would be interested in the job. I applied, and I got it. So I've been there for about 2 years. I see about 99% of type 2 diabetics, and mostly middle-aged, a little bit older, that sort of thing.
That's, of course, the epidemic, and that's the group that needs a lot of help.
Yes.
And I've said this before, but sometimes people are depressed, and they don't realize it. And diabetes causes depression. And then if you're depressed, you can't go exercise or take care of it because you just, all your energy gets used up going to work and going home.
I'm fortunate. I work for a hospital, but I'm working in an outpatient setting, and my office is in a fitness center owned by our hospital. So one of the things that we do for the patients who attend our entire group program, we give them a 1-month free membership to our fitness center. So we inspire them to go out there and exercise, and we have a personal trainer to work with them. We have an exercise physiologist come and teach in our classes, and we talk about different forms of exercise. If they can't run, they can walk, or they can lift weights, or whatever works for them.
So are you saying the hospital health insurance pays for a personal trainer?
Not the
Not
hospital.
yet.
No.
That was always my dream, is the hospitals ought to be attached to giant gymnasiums
Right.
with trainers, and you should go like an hour before your appointment and work out. I mean,
Right.
in healthcare, it seems like they've made the exercise like a separate option.
And it doesn't, but their insurance, whoever comes to see me, their insurance pays for them to come to see our classes, and then we give them a free membership where they have access to a personal trainer.
Well, you're just inspiring. I'm inspired. 60 races a year, and I haven't run a race in I don't know how long. So.
Well, you need to join me out there.
Because I like to run.
I do too. It makes a big difference.
Yeah. Thanks for coming on our show.
Thank you so much.
I'm going to give you a hug.
Thanks.